Hi, my name is Greg Felt. I'm Director of Public Health. This is a situation report of today, the 22nd of March. Epidemiology, in a few words, stable, and we're shifting from looking at rates to looking at impact. So R is fairly stable over the weeks, still 0.7 to 0.9 for Yorkshire, and the infection survey that was published by the Office of National Statistics, about 1 in 350 or 0.3% of the population have COVID at any one time, and that's stable-ish. 7-day rate has gone from being fairly flat to actually it's been increasing over the last couple of weeks. That's happening in lots of parts of the country, and Sheffield is obviously no exception. Principally driven by school age and working age. That was always predicted to happen once schools got fully back. Some of those of working age clearly have always been out and about, and some more are now out and about and able to interact with others because their kids are now at school. We're doing a lot of testing asymptomatically, particularly around schools. Last week in northeastern Yorkshire, 1 million tests were done. So if we look, we find, and as a result, rates are going up. Importantly, the over 65s rate is stable to going down. It's actually going down reasonably quickly. And the harm, as measured by the number of people in a hospital bed with COVID, is definitely going down, and that's definitely the impact of the vaccine. So it's uncertain how all of that plays out in the medium term. And clearly rates are going up in Europe. It's fair to say that Europe aren't as well vaccinated a population as this country. And there still is a long way to go even in this country with over 60s vaccination, so we still need to continue to push in that space. So we're still on track with regard to the roadmap. We're still right to carefully reopen. We won't be relaxing some of the individual level measures, washing hands and face coverings, etc., probably for some time. If you have symptoms, then get a test. So remember, we are still in lockdown, so all of the guidance that's in place around social mixing still is in place. So on vaccination, we're now getting into second doses. So patients who received their COVID vaccine in December 2020 are now being invited for their second jab. People who received their vaccine at a local vaccination centre will be contacted by their GP practice to arrange the second dose when it's their turn. You'll be contacted about 11 weeks after the first vaccine. Please don't contact your GP. Your GP will contact you. And you may be offered a vaccine at very short notice. People who were booked through the national booking service were required to book their first and second dose at the same time, therefore they won't be called back through their GP practice. It is really important that you get your second dose when you're called. Receiving both doses of the COVID vaccine gives you the best protection from becoming seriously ill if you contract COVID. Being vaccinated doesn't protect you completely, but it's definitely the best defence in the fight against the pandemic. Like all medicines, vaccines can cause side effects. Most of these are mild, most of them are very short term, and not everyone gets them by a long stretch. If you've experienced side effects after the first dose, don't be put off going back for the second dose, because you do need the second dose to be fully protected. So don't skip that dose. We don't know how effective the one dose will be in the long term, which is why it is really important that we get 2 doses, because that's how we initially trialled the vaccination programme. And if you don't have the second dose, you might be putting your health at risk and have complications of COVID if you catch it. On asymptomatic testing, there seems to be confusion between the 2 types of COVID tests that are available. The lateral flow device, or LFD tests, you can pick up for yourself, but they do not replace the PCR tests that are given at the various COVID testing sites across Sheffield. Please don't use LFD tests, the ones that you'll have at home, if you or anyone in your family have COVID symptoms. Symptoms, no matter how mild they are, high temperature, new continuous cough, changes in loss of taste or smell, you shouldn't ignore them, and you must book a test at one of the 6 testing sites across Sheffield immediately and self-isolate, and details on how to book will be at the end of this clip. A test taken at home is for people who don't have symptoms. these tests don't replace the tests taken at COVID testing sites, and they're to identify people who don't have symptoms. Transmission in and out of school is hot in my inbox. Schools are definitely doing everything they can to keep students and staff safe. I think it's fair to say a minority of parents are risking the safety of others by bending or breaking the COVID rules. I can't stress these two following points enough. One, we're not out of the woods by a long stretch. The virus is still there, it's less prevalent, but it's still there and it's still dangerous. And secondly, school bubbles are designed for school because all of the protective measures that are in place around that, like ventilation, extra cleaning, face coverings, it's highly unlikely that that's going to be in place outside of a school environment. Therefore, children shouldn't be mixing with their school bubble outside of school. We've received reports of children having sleepovers and play dates with friends. I've received reports of children with symptoms not being tested and being sent to school, and a lack of social distancing. That will cause an increase in cases. It may slow the implementation of the roadmap and our route out of lockdown, and has resulted in whole classes or whole year groups being sent home, which is very disruptive for everybody. So we'd like to think we're not at risk, but 1 in 3 people may not have symptoms but can spread the virus without knowing it. The vast majority of cases are caught in home, and it spreads much more easily in indoor spaces where people are in close contact with each other for quite some time. So as the restrictions ease, it's still important for people to follow the guidance and for us all to play our part in stopping spread. Until more people have had both doses of the vaccination, please continue to avoid meeting indoors with anyone outside your household or family bubble. Please think about what you're doing, because the consequences of your actions will have consequences for everybody. So we'll need to stick with the guidance for a bit longer, and that will enable us to get back to normal quicker. We know that most are being responsible, most are following the rules, and thank you to everyone for what you're doing to keep people safe. And for always, if you need more information, look on the sheffield.gov.uk/coronavirus site.